surgery as we speak. He has established himself as one of the leading cardiologists, not only in Goa, but also in India. He's served in hospitals in Mumbai and other very important centers, and he's been involved in adult intervention as far as cardiology is concerned for the last 10 years. So he's something of an expert in cardiology, and we are very lucky to have him join us and to thank him for joining us at such very short notice. It would have been pointless me being in Goa attending the diabetes center without having someone from the center there. So he is extremely welcome. Dr. Pandigan, thank you so much for joining us. I know it's late for you. You've had a very busy day conducting operations at the Victor Hospital in Margao. The floor is yours. We'd like you to speak for 10 minutes or so, 10 to 15 minutes, on the subject, your heart and your diabetes. As we know, a lot of people with diabetes suffer from heart conditions. So it's over to you. After that, please stay on because we have already got a number of questions. We'll go from Goa back to Leicester, and Hanif from the Silver Star Centre will be sending some questions to you. So a very, very warm welcome. It is very, very warm here in India. So a warm welcome to you, and the floor is yours.
I think you need to unmute.
Yes, we can hear you. Perfect.
Yeah. Thank you for the invite. I would say this space needs a lot of work to be done in prevention and awareness, especially when diabetes is actually growing like anything. The way the AI, artificial intelligence, is growing, diabetes is growing way, way, way fast, more than the AI, I would suppose, because of the lifestyle habits, lifestyle changes, and the amount of what you say, fastening of the lifestyles. We don't even fasten our seatbelts so fast as our lifestyle is fastened. Like, we need everything immediately. We don't have patience left anymore. So food is being ordered nowadays. Nobody eats food at home. Everybody is having all those ready to eat stuff. So diabetes is definitely bound to happen because of all these lifestyle choices, because every human being has got the same pancreas, and yeah, they will definitely fail if we are not taking care of it. So what is actually diabetes? Diabetes, the first myth I would like to destroy everybody's myth is it is not a problem of eating sugars, or it is not a problem of sugar at all in the first place. The problem is the body is just refusing, or the pancreas, or the beta cells in the pancreas, which are the workers in the pancreas, are just failing to produce or secrete insulin, thereby leading to not metabolizing the amount of food which you are eating. Okay, all the food which we eat is called as sugar or carbs by the chemical name in the textbook of medicine. So whatever we are eating, it is not getting neutralized. All the excess is being stored. What actually happens when this failure of beta cells to produce insulin, leading to diabetes, actually occurs? What it causes is accelerated atherosclerosis, or in simple words, we call it as accelerated aging. Like, if you're going to age at the age of 40 years, you will be aging at 60 years at the age of 40 years. So your internal organs, most important, the brain, the heart, the kidneys, the liver, and the eyes, and the sensory organs. Your skin, most important sensory organ is skin, that is a touch. So that is controlled by the nerves. Okay, so all of these important vital organs, they age very, very, very fast when the patient is detected with a diabetes. Okay, now diabetes is of mainly two types. One is type 1 and the other is type 2. Type 1 is very unfortunate because the kids who are with type 1 diabetes, they are born with genetic mutations, thereby leading to improper metabolization of the sugars. Type 2 is basically what we get because of our own mistakes or because of our own lifestyles. Lifestyle is only divided into a triangular portion. It's like the first part of the angle is your food, second is your exercise, and third is your stress. Now, bad food habits, no exercise, sedentary habits, and a lot of stress or undue stress or unrequired stress, which can lead to altered sleeping patterns, thereby differential hormonal release contributes to the development of pre-diabetes followed by diabetes. Okay. So when a patient is diagnosed with diabetes, definitely he has already been diagnosed with pre-diabetes 5 years back. Most important, when we say that I'm fit outside, that does not mean that you're fit inside. So your labs would tell whether you are a pre-diabetic or whether you are a diabetic. So if you are a diabetic, you have to be very much more careful. It is not like that the diabetes doesn't revert back. It reverts back. The insulin secretion which happens in the pancreas, if they are normal, but the amount of lifestyle habits or lifestyle patterns, it is, we call it as a disbalance between the lifestyle as well as the insulin secretion. Like your insulin secretion is normal, but you are morbidly obese, you don't have any activity, you are highly sedentary, and you take a lot of stress, and the diet is haywire. Okay, so in that scenario, normal secretion of insulin or the normal levels of insulin is not going to help you in controlling the metabolism of these added food stuff. Okay, so that is why in such patients, when they go for lifestyle modifications, reduce the weight, get into exercise regime, and reduce the de-escalation of the stress, definitely their sugars are well controlled, and a day comes when definitely they don't need that insulin, or they go very low on the drugs, or hardly any drugs, sometimes drug free also. Okay, so this is the main reason why this disease has a very much important part in today's era. Because see, it is not a communicable disease like that my friend has it, I'm going to get it. No, it is not like that. But yes, my friend has bad habits, I'm also going to have the same bad habits. Yeah, definitely you are likely to get it. Okay, so it is a non-communicable disease, but yes, it is spreading at a very fast rate. Okay, nowadays we work more post pandemic because we have got a lot of stress. Pandemic has caused a lot of financial burden, so to clear off the burden, we are working maybe twice more as pre pandemic levels, and we are not taking care of ourselves. Okay, pandemic made us realize that health is the first thing in everybody should be considered about. Okay, so in this scenario, why we have to see that diabetes and its control. So first is checking about yourself, regular proper evaluation of yourself, for that whether you have diabetes or whether you don't have diabetes. Are you falling in impaired fasting glucose or pre-diabetic levels? And if you have been diagnosed with diabetes, then taking definitely proper care of your diabetes, making your sugar levels under control, proper monitoring, thereby leading to reduction in the speed of internal aging. We call it as accelerated atherosclerosis. Yeah, definitely will be there, but you can reduce the speed of progression of this disease. What actually it causes? The unmetabolized sugars basically causes multiple deposition of plaques. Whatever the sugars are left in the body, not metabolized by the insulin, they eventually, in plain simple terms, they form plaques. Plaques, or we can call it as layers of cholesterols. Yeah, cholesterol is also a part of sugar chemistry only. So they form layers of cholesterols, and these layers, where will they go? They'll get stuck to the walls of the arteries. Our entire human body is made up of an entire plumbing system, which has got two pipes, the arteries and the veins. The arteries carry oxygenated blood and give oxygen to each and every cell of your body. And the veins take the blood from these cells after the oxygen has been used up and take back to the lung for reoxygenation. Okay. And who does this job? The job is done by the heart. Heart is basically a pump which supplies blood to all the vessels of your body, thereby to all the cells of your body. Receives the blood which is impure and delivers it to the lung so that it can be purified, and again delivers it to the tissues so the oxygen can be extracted from the pure oxygenated blood. Okay. Same blood vessels are there in the kidneys, and same blood vessels are there in the liver, as well as in the lungs, as well as in the brain. So if the unused or if the excess of sugar in the body is going to form the plaques, So thereby these plaques are going to get layered off, or layer over layer, they are going to happen in all of these organs. Okay. Starting from even the nerves of our body are supplied by blood vessels. The nerves also get some blood vessels. They are very finer blood vessels. That's why in diabetes, when the sugars are highly under control, the first thing which the patient develops or is a neuropathy. The pain sensation, which has been transmitted by a C fiber nerve, it's lost. Okay. And that's a very sad thing, because if your pain sensation is gone, you will have you can mistakenly hurt your foot, but you won't get the pain. Thereby the wound will increase, the size of the wound will increase, it won't heal. So these are the problems. You might get a pinprick in the leg, but you will never realize that you got a pinprick actually. Thereby you would lose the opportunity to take a tetanus injection. The wound it will become a wound, it will turn septic. So pain is a very important sensation. So because of diabetes, because of excessive plaque deposition in the vessels of these C fibers, pain is lost. So that's a big thing. So a big sensation is lost. So that's the reason why we need to have tight control. In spite of control of diabetes, also patient can get this problem of loss of pain, because the progression had already happened and then the control was done. So if anybody randomly goes for a health checkup, sugar is the first thing has to be seen, then the HbA1c levels are seen. If they are found to be that is a time when you actually the nutritionist and a physiotherapist all being considered. They're called as a complete diabetic workup and therapy unit. So that helps in understanding the modality of disease as well as taking further precautions. Okay. So this was a basic thing about diabetes, why this is more dangerous and why it is not just about sugar. Okay. So the main reason is loss of beta cells in the pancreas to produce insulin, or a reduction of insulin production, or maybe we can call it as an imbalance between the insulin produced and the food consumed. Okay. So this has caused more number of deaths than any illness in the world, because it affects the eyes, thereby leading to blindness. It affects the patient's brain by causing strokes and crippling the patient sometimes so severely that the patient becomes bedridden. Third, it is the major cause of around 2/3 of the heart attacks all over the world. It also causes peripheral vascular disease and other neurological disorders. Okay. So coming to the most important part among all the organs is the heart. So as you can see the picture over here, this is a heart, standard biology textbook picture, which has got coronary arteries. These arteries are very small vessels, maybe around 3 to 5 millimeter diameter, and they supply the muscle of the heart. The heart is a pump which pumps the blood into this pipe, which is actually taking the blood to all. This is the brain, this is the upper limbs, and going down to the lower limbs. And this is the pipe which receives the blood from the upper part and the lower part, which is after extraction of the oxygen, thereby sending through this pipes to the lungs for purification. Now this muscle needs blood supply, a good blood supply to work on. Okay. So these are the vessels supply the blood to these muscles of the heart, to these cholesterols slowly over a period of months to years, thereby forming a mountain of plaque inside a tube. And when this tube, the diameter of the tube remains same all over the body, okay, means it is more of like a constant. So this diameter is reduced, or the lumen is becoming narrow because of the plaque formation and the growth of mountain of the plaque.
Doctor, could you wind up on this, because I think we've got a number of questions on these very subjects.
Okay, so this is what happens. Second, when there is a heart attack, there is a block in the vessel and the tissue is destroyed, thereby leading to ballooning of the tissue. You can see here, this is a normal heart function capacity. After a heart attack, this is what it happens, a reduced capacity. So these are the signs of getting a heart attack. chest pain, cold and sweaty, sweaty fingers, pain in the neck, left arm, and sometimes a feeling of indigestion. Most commonly, because of feeling of indigestion in maximum diabetes patients, you are going to miss a heart attack. Diabetic patients don't get typical classical pain. That's why they miss the heart attack and they'll eventually come to the ER with complications. So abdominal obesity, high blood pressure, smoking, high cholesterol, and diabetes. These are the modifiable risk factors which we can change and thereby leading to a healthy heart. So how you diagnose this? You basically send an ECG, or you can go for a treadmill test or an echo and blood sugar and cholesterol levels too at the preliminary levels when you don't have any symptoms. Therapy is very well known to most of the world. It is either an angioplasty or maybe multiple blocks. You can have a CABG. But prevention is better than cure. So what I would suggest is anybody who is more than the age of 20 years should basically undergo a preliminary health checkup involving their basic parameters of blood sugar levels, renal profile, a liver profile, as well as their eye examination and urine examination to check for any sort of non-communicable disease like diabetes or maybe high cholesterol levels. These are all found in these blood parameters. Okay, and Dr. Pandyan, should always undergo a treadmill test. Yeah.
Thank you so much for that.